I'm Valentina Wilson. In your community, a doctor's office on wheels is helping to reach patients in rural and underserved communities. Today, we're giving you a look inside the Kinston Community Health Center mobile health clinic. Anna Kinsey is the center's community development director. Thank you so much for coming in, along with Karaya Ramadan, who's an intern studying at ECU. Ladies, welcome.
Thank you.
First of all, how is this unit even possible?
It's possible from funding through HRSA. That's federal funding that we received when COVID hit. And community health centers were responsible for taking clinics out into the community to give vaccines and teaching and things like that. So that's how it started.
And now you're a year into it almost, started summer of last year.
Yes.
How many people have you reached in that time?
We've seen about 500 patients so far.
500, so making a difference.
Yes.
What are you hearing as far as stories regarding transportation? Is that one of the issues you're finding? Are these hard to reach communities where people lack resources?
Transportation is always an issue. That is one of the social determinants that we have to address almost every day with our patients. Because community health centers are located in rural areas, they can't get to the doctor's office. So that's why a mobile unit program is so much better for our communities, because we take the health care out to them.
And Karaya, I understand this is your project.
Yes.
How did you come up with this idea and why?
Well, when I came, it was already an idea that was already in fruition, but we were just trying to find a new location to take it to. So we basically just went out and surveyed the community to find those social determinants that were in need, and then a location that could help as many people as possible.
And so how did you zoom in on these particular locations?
Like I said, through those surveys, we surveyed in multiple locations with multiple people, and we just put it in like a data form, and then we figured out which place was most in need.
What did you ask them?
We were asking if they lacked transportation, if they were insured, what type of medical services they needed the most, and that was it.
And are you finding that many of the people who receive these services are uninsured or underinsured? How is that factoring in?
It factors in a lot, because a lot of people don't want to go to their doctor's office because they're scared. They don't have the money to pay for it. So we're able to step in and help them with that.
And so when we get to the root of these issues, is it financing? Is it a lack of insurance? And what would you say are the determinants here?
I think it's the poverty level that our population faces in the counties that we serve. And a lot of the social determinants that we have to address not only includes the transportation, it includes food insecurity, it includes a lack of access to health care, and that will be because they think if they don't have insurance, that they can't come in to see a healthcare provider. And with community health centers, we provide the slide scale discount program, so that is what it makes sure that they can get in to see a provider.
And what specific services are they receiving?
We have family medicine, we have dental, we have OBGYN, we have mental health, we also have a pharmacy on site, and we have a community outreach department that actually goes into folks' homes and they do health education, they might do medication reconciliation, they do initial health assessments to make sure that they are navigating the patient through the healthcare system and to the right provider.
Is there an age limit? Are we talking about babies to the elderly? What are the age groups you're seeing?
We are talking from babies to the elderly. There's no age limit.
Everybody.
Everybody.
This is so great to hear about, and reaching hundreds of people right here in Eastern Carolina. What counties are involved here? Can you tell us about that?
We're primarily located in Lenoir County, but we serve the surrounding counties, and those include Duplin and Jones and Greene, Craven. We also include Wayne, and then we have patients that are in Onslow County as well.
And Karaya, what would you say to someone who's just searching YouTube, might come across this interview, if they live in some of those areas? What would you tell them to do?
You can find us at our website at kinstonhealth.org, and then you can find us on Facebook, Instagram as well.
And what is your Instagram and Facebook?
If you just search Kinston Community Health Center, it'll pop up.
Everything will pop up there.
Yes, ma'am.
That is great to hear. What kind of feedback are you getting from people? How appreciative are they?
Yesterday we had our event, and it was a lot of people saying very good reviews. They're very appreciative, and they appreciate our efforts in helping them.
And in particular, what does it mean for families, do you think, Anna?
Again, increased access. I mean, that is the bottom line, increased access. And we are actually getting ready to start telehealth via our mobile unit. And we were able to get a grant a couple of weeks ago through the Office of Rural Health, and which is providing hotspots for patients in areas that don't have Wi-Fi, so they'll be able to connect with the doctor.
And so this is happening every fourth Thursday of every month.
That's correct.
Ever since last summer. Your most recent event was just yesterday, which was Thursday, and it took place in Goldsboro. What happened at that one?
Well, we actually connected with Hope Extended Ministries in Wayne County, and the minister there wanted to start a mobile unit because the folks that they serve are uninsured or have Medicaid and can't get to a doctor for some reason or another, and asked us if we would take our mobile unit out to him. And we did. We actually had 26 patients on the schedule and ended up seeing 18 patients yesterday.
So a big day for you.
A big day, yes.
And Karaya, when is the next event and where?
The next event will be in the next month, and it's going to be
At the Friends of the Homeless Shelter in Kinston in April.
Okay, so bringing it back home to Kinston
Yes.
for that one. So who actually drives this RV?
Well, we all are trained and to drive that RV. Even I can drive the RV. But we do have two guys that are in my department. They're wonderful, Gary and Victor, who actually can drive the unit around for us.
And the doctors who participate, or I'm not sure if they're PAs, physician assistants. Tell us a little bit about that process.
Actually, Dr. Ricardo Valdivia, who was on the unit yesterday, he's an MD. And we do have family nurse practitioners that go on there. And we also have FNPs that go on there. We also have midwives that go on there. So
that's great.
It's all, and we will be having a PA go on there later on throughout the year.
And so the midwives, will they check women who are pregnant?
Yes, they can.
So you've got that type of screening
Yes.
going on too. How are the doctors and nurses and medical professionals selected? Do they volunteer? How does that part happen?
They volunteer their time through the center, so they are on a rotational basis, and whoever says, okay, I'll do it, Anna, they'll go and they will be on the unit. That's not always very easy though, because you have to look at their schedule in-house
Yes.
and then look to see if they're able to go on the mobile unit as well.
And this is like a volunteer thing for them.
Yes.
This is great. So again, folks, every fourth Thursday of every month, you will see this RV rolling out across 7 counties in Eastern Carolina near Lenoir County. So those counties again, Lenoir, Duplin, Wayne.
Greene, Jones, Craven, and then Onslow.
There you have it. And if you're interested in learning more, signing up for care, or even volunteering as a physician, you can give them a call or reach them on Facebook. And was the other handle Instagram?
yes, and the website as well.
And the website too. So many ways to reach out. More information can also be found on our website. It is WCTI12.com. Rolling in your community. And with that, I'm Valentina Wilson in your community.